Testing, testing, testing. Hi there, guys. My name is Rohan, and today we are going to be talking about anesthesia. Today we're going to be talking about what is anesthesia, how does it work, and the three types of anesthesia. So let's say, for example, one day you had to go to the hospital for some major surgery. Okay, maybe one of your organs shut down, there might be some problem, maybe a tumor, who knows, right? And when you're on the operating table, right, before you actually get to the surgery, you look at the doctor or nurse, right, and they inject you, and they inject you with something, and they say count to 10 downwards. So you count 10, 9, 8, 7, 6, and just pass out. Then the moment you finally, just in a snap, you finally wake up again, right? And then you say, and then you look down and you see stitches already there. Surgery's already been done. But how is that possible? You're awake and it's already been done. You have no memory of what just happened, and the best part, you feel no pain. That's basically what that's basically what happens when you're under anesthesia, because you were just under anesthesia. So how does it work? Okay, and it's basically induced by medicines called anesthetics. And the thing is, there are three types or three parts of anesthesia. Okay, there are three types: local, regional, and general. Let's look at each one of these types, shall we? The first type being local, okay, which only is used in minor cases. For example, let's say you were at the dentist, right, and they want to remove some teeth or whatever. They'd inject you with a local anesthesia. What this does is basically numbs a small specific spot, and this specific spot basically means that all the pain signals and receptors there can't reach the brain, hence making you immune or technically painless to that specific spot. Okay, and during and when you're under local anesthesia, you'd be awake or sedated. Okay, and it takes a short amount of time to wear off, and mainly is used in uh, in small surgeries and just small stuff and small procedures. Okay, that's what local anesthesia is. Now let's look at the second type of anesthesia: regional. Regional anesthesia works like this. Let's say instead of some minor injury, let's say we have something around average. Let's say you have a injury, for example, a broken arm or something like that, right? You need it fixed. So what they do is they inject you in a cluster of nerves, okay? They inject regional anesthesia. So what does that do, okay? It basically numbs a major part. For example, an arm, leg, hip, just are some examples of basically what it does. It basically severs off that entire area for pain, okay? How it does that, okay, is, as we know, pain works through electrical impulses through our nervous system. What regional anesthesia works is it acts as a barrier, so that way the electrical signals can't get to the brain. Okay, how it does that is that at the proteins at the neuron cell membrane, okay, they attach to that. So that means only the negative charged uh, protons and stuff like that, right, can enter, but the positive charged ones are cannot enter in. Okay, which causes a blockage. Okay, which allows you to cut off that entire area and they can do the surgery or whatever. But what happens when, like, for example, in the beginning, right, in our example, like, for example, like in major injuries, right, you need full-on surgery, a heart transplant, maybe one of your organs failed, right? For major stuff like that, we'd use general anesthesia, okay? You mainly intake it through either an IV or as gas through a mask or a tube inside, okay? And what this does is, like, the reason why we do that, like, why should we, okay? And the thing is, okay, general anesthesia acts on the entire nervous system. So not just one specific small area or just one body part. It works on the entire body. Okay? So why we do it is, you see, our brain, okay? Our brain, our little brain inside, is all the electrical signals and stuff are in chaos. They're rummaging through everywhere, right? Electrical signals going there, bam, 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 right? And those electrical signals in chaos help us stay awake, okay? What general anesthesia does is it calms them down, okay? It makes those signals more organized and makes them not communicate with each other, okay? And calms them down, making them slower, and that happens, okay? But how do these drugs actually work? Well, it's not really known on how they actually work, but we just be thankful for its invention and its use in medical technology and yada yada. That's basically the main gist of what anesthesia is. And that is basically it. Thank you for watching this video and hope to see you next time. Bye bye!